This information is not intended as legal, health, or nutritional advice. It is provided for informational purposes only. The Natural Health Product Protection Association does not endorse or accept responsibility for statements, views, or opinions presented by guests or attendees. Help us help you. If NHPPA's work to protect your natural health product and practice freedom is important to you, please make a one-time or monthly donation. Significant funding is needed over the next year to finance our campaigns.
Greetings, everyone. It's time for another NHPPA show. It is so great to see everyone logging in from all over the country already. Lighten up chat. Keep the comments coming. I'm Jason Dahl, and I'm here with your host, Dana Fiorino, and NHPPA President Shawn Buckley. For those of you joining us for the first time, I would like to highlight that the question and answer portion of today's show is exclusive to our live shows. This won't be in the video feed that's put up later. Be sure to post your questions in chat throughout the evening, and we'll select ones to present to Shawn and the team as we go. And with that, Shawn, I'll turn it over to you.
Thanks, Jason, and I'd like to welcome everyone for attending today. My name's Shawn Buckley, and I work with Jason and Dana at the NHPPA, and very thankful to be welcoming you. The NHPPA, we started as a federal nonprofit in 2008, and we're still a federal nonprofit, but we're dedicated solely to protecting access to natural health products. And as it turns out, when we started, our intention was to be an industry watchdog, but it's the consumer, it's the citizen that has gravitated to us, and that enables us to help you create political pressure like no other organization can. Our whole landscape and our whole access to natural health products would be completely different today, but for the NHPPA and you working with us along the way. So I want to thank you for working with us along the way. I'd like you to encourage you to donate to us. Jason, I'll ask you in a minute to throw the donut page. Yeah, no, don't put up the NHPPA donut page. The donate page. I'm not going to tell you what we're going to announce shortly, but we've decided internally to embark on a project that is different, much different than anything we've done before, and much larger than anything that we've done before. And my feet are hardly touching the ground. I'm so excited about it. But it's going to tax our resources like nothing before. It's going to take resources that we don't have. And that in itself is tremendously exciting. So looking really forward to that. So just wanted to welcome you. Thank you, Jason. Thank you, Dana. And thank you, everyone who is participating. This is our second one where we're live streaming on a whole bunch of different channels, Rumble and X and YouTube and the like. And very excited for you to be joining us on these platforms, and excited with the team and giving us the opportunity to reach a new audience.
Thank you, Shawn, for that great intro. As you can see, there's a QR code up above to donate to the NHPPA. We've got the URL available in the ticker down there at the bottom. If you love the work we're doing, NHPPA is the only organization that can motivate the citizens to create the political pressure necessary to protect natural healthcare products. The future of the NHP industry depends on the NHPPA and your financial support. And with that, we'd like to move on to the feed. Dana, take it away.
All right. Hello, everybody. So I want to start out with a question for you. Do you remember when the recommendation to just eat a balanced diet was the answer to everything? Well, it turns out that advice might not work anymore because food isn't as nutritious as it used to be, and that's one of the reasons why natural health products matter more than ever. Unfortunately, new regulations are making them more expensive and harder to access. So let's talk about this because it's something that needs more attention. Many modern farming practices, such as pesticide use, monocrops, and overfarming, have depleted our soil of essential minerals. And when nutrients disappear from the soil, they disappear from our food. In an image that we're going to throw up right now, you'll see that in a 2024 review, the nutrient density of fruits, vegetables, and other food crops has dropped significantly over the past 50 to 70 years. In this next image, we'll take a look at some of the individual minerals that have been reported. Sodium content has dropped up to 49%, potassium up to 19%, magnesium up to 24%, calcium up to 46%, iron up to 27%, copper is up to 76%, and zinc up to 59%. Now, last week, we shared a video interview with Dr. Bonnie Kaplan. She is an expert in the field of micronutrients and brain health, and she had a lot to say about topsoil. And we want to show you a clip from that interview right now.
But it all begins in the soil. 6 inches of topsoil is determining life on Earth. One of the things I try to do, Jason, is I try to educate people as to how we get nutrients because people don't know. But the minerals have to be in the soil. The plants have to be healthy enough to uptake them. And then the plants have to be healthy enough to use the minerals to manufacture vitamins. Then we come along, we eat the produce that comes off of those plants, or we eat the animals that have eaten the produce. And that's how we get most of our vitamins and minerals. But it all begins in the soil. 6 inches of topsoil is determining life on Earth. And so if the soil is depleted, and we have very good evidence that in many places it is, then we are not getting the ideal amount of vitamins and minerals in our food.
So even if we're doing everything right and eating balanced meals, quote unquote, it's possible that we're still not getting everything that our bodies need. And this is a time where natural health products can come into the picture. Things like vitamins, minerals, herbs, homeopathics, and even probiotics. They can help to fill in the gap that our modern food supply is leaving behind. From correcting and preventing deficiencies to strengthening our immune systems or helping us recover faster, this is a time when natural health products become truly essential. But while our food supply gets worse, nutrient deficiencies increase, and chronic disease rates go up, Health Canada is making it harder to access natural health products, when arguably they should be making it easier. They're replacing our current natural health product regulations with a new plan called the Self-Care Framework, and also introducing cost recovery fees to the natural health industry. These changes will negatively impact consumer choice and reduce access to natural health products. They'll also place a huge financial strain on businesses, leading to higher prices for consumers, but maybe even forcing small to medium-sized businesses out of business entirely. The new regulations will also prevent truthful advertising by both manufacturers and natural health food stores, resulting from increased Health Canada censorship. And lastly, huge new fines will destroy the natural health industry. Prior to June 22nd, 2023, the maximum fine you face for violating the laws on natural health products, such as selling a product with improper labeling, was $5,000, but now it's up to $5 million per day. In short, the things we need most in a nutrient-poor, toxin-heavy world are being regulated as though they are dangerous. So let us be clear, Health Canada should be making these products more accessible, not less. And it seems that the vast majority of Canadians agree with that statement. Here are some of the comments that we've received lately on social media. One person said, "This is worrisome. So many of my patients and myself rely on natural medicines that have helped mysterious conditions when nothing else has helped." Another individual said, "It is not a health system, it is a sick system. I work with ALS, and all of the ALS reversals who are either reversing, slowing down, or stopping their symptoms are all holistic, no pharmaceuticals. There are a lot of people relying on natural health products to manage serious health conditions, and they have the freedom of choice to do so. But if they can no longer access or afford what they need, it will be devastating for them." Another comment says, "Sends a very clear message from Health Canada, doesn't it? They are not here to help you, period." Health Canada claims that their new regulations are meant to promote safety and protect Canadians, but based on the feedback we're hearing, Canadians, number one, do not feel that they need increased protection in this already extremely safe and low-risk industry. And number two, by reducing access to natural health products, Canadians are feeling the opposite of protected. They're actually feeling quite worried and at risk. Another comment reads, "We need to start asking questions. Without herbal remedies, so many people would be suffering. Government needs to take their hands off natural healing." We absolutely need to start asking questions. And from our perspective, Canadians are becoming more vocal about this, but there is strength in numbers, and so many people still have no idea that their natural health products are at risk. Spreading awareness is a simple way for you to play a really big part in this. And to make it easier for you, we've curated 4 action kits with helpful downloads. One is for retailers, manufacturers, citizens, and practitioners. They contain various resources, including posters to help educate others. There's also a Charter of Health Freedom information sheet and petition kit, and quick access to all of our postcards. Now, what you do with these resources is entirely up to you, but we have suggested a few ways for you to make use of them. Retailers, for example, can hang posters up around their store or display them at the checkout counter, along with a Charter of Health Freedom petition page. Manufacturers could send resources out to their clients along with orders. Citizens could hand them out to family and friends. You could share them on social media. You could also use the information as talking points and contact your MP. Or you could even write them a letter and print out our resources and throw them into the envelope as well. Practitioners can display them in their clinics and talk to clients about it. The possibilities are really endless, and I would love to see what you come up with. So after the show, when you go and download your action kit, whether you hang posters up on your mailbox or in your store, whatever you decide to do with these resources, we would all love to see it. So take a picture or a video, tag us on social media, any of our platforms, because this is an issue that affects every single Canadian and that every single Canadian needs to be aware of. And that's a big task, but it's one that all of you listening right now can help with. And we've made the tools, and now we're so excited to see you all put them to really good use.
Fantastic. I can't wait to see social media posts of people that have printed these action kits out. They're in stores. They put them up in public places. I can't wait to see images from you guys at home of what you've done with these action kits, and practitioners and natural health stores as well. Very exciting times. With that, we are going to move on to everyone's favorite section, Buckley Unfiltered.
I was challenged today because I learned of a long-standing business, a chain of health food stores that started as one store and grew and grew, and it's kind of like a fixture in their location that they're shutting down. And I'm just aware of so much stress in the industry because of this regulatory burden. And the thing that's really, grabbing me is we weren't regulated at all not that long ago. And they're not regulated in the United States. You don't have to go through this government pre-approval and licensing scheme. And in the United States, there are no safety signals. There aren't. The FDA isn't saying, "Oh, we've got all these injuries we need caused by NHPs. We need to regulate them." In fact, arguably, we have worse safety signals in Canada because, whenever the Standing Committee of Health is considering something, they come up with all these scary numbers, but they won't share their background data so anyone can verify them. So we know they're not true. But it just grieves me that here we're losing family businesses. We're, paying such high prices that are unnecessarily high because of the regulations, which means a whole bunch of us can't access them at all. And everyone knows that it's just a show. It's just theater. It's not necessary at all. This is just privileging one industry over the other, and it's over the wishes of Canadians. In the last, 16 months, the NHPPA tracked probably about 3.3 million communications to MPs that have gone through us. And the majority of those paper communications, so we're not even talking electronic communications, every MP knows this is the biggest issue facing Canadians. And all we want is we want the government to leave us alone and let us to access natural health products, get Health Canada out of this. They have no right to be there anyway. They're regulating us under the criminal law power, and we're safer than peanut butter. So, I mean, the whole thing is a fraud. And it's just so interesting that it's interesting that it's happening, and it's interesting that we're allowing it to happen. And it's interesting that even with just this incredible pressure that you've brought through the NHPPA in, the last 16 months, that we're still here. So what's the solution? Because we've lost a lot in this last couple of years under the self-care framework. So moving us into the therapeutic product category, where we've gone from like $5,000 per offense fines to these $5 million a day fines. The amount of censorship has just gone crazy. And, for the last 31 years as a lawyer, about half my practice was fighting Health Canada, and not just in court. I've defended more natural health product companies when there's charges, criminal charges, than all other Canadian lawyers put together. But running interference when there's not charges, when Health Canada is saying, do this, do that, you're helping people, you better stop. And, I've been on the ground, and it's just been awful. But now with these $5 million a day fines, I'm actually glad I phased out of law. And now, the NHPPA in this fight, it just requires my time. So I'm not really practicing law anymore. But I'm glad, because it would grieve me when a natural health product company would, if they came to me and I'd basically say, you can't resist anymore, because we're just in this zone that it's just gotten too crazy. And when they bring cost recovery in, like we're already behind the scenes, the industry is in absolute turmoil with what's happening. But, when cost recovery comes in, you're really going to see it. And we're just going to have that crystallizing moment, I think, in the industry where we truly come together and make things happen. So how do we solve this? Because it just seems that, Health Canada plans in like 100-year cycles, where if we create political resistance on something, they'll back down for a while. And I predicted at our last NHPPA show that, we're going to see Health Canada say, oh, no, we're going to back down on the self-care framework and not go with those regulations where they're full harmonization. But they've already got about 80%, and they just know that's not politically feasible right now. So they'll wait until the resistance backs down, or there's more consolidation in the industry. We're starting to be purchased by very large players, including the pharmaceutical industry. And we'll find that the culture's changed, where we're no longer an industry based and run by people that actually want to make a difference and want to help you. I'll just share that, I started practicing in this area in 1994. And when I started acting for natural health product companies, it's got to be at least the first 15 years of that practice that every single one of my clients got into the business because they or somebody they loved, they were either dying or suffering terribly under the chemical pharmaceutical stewardship of their doctors. Then they came across a natural health product that solved their problem, either saved their life or, healed them so they were healthy instead of terribly sick, or somebody they loved were. And they felt morally obligated to quit their job, start, get into the NHP business to help people. And so then when Health Canada would be attacking them, because they are violating the law. I mean, back then you couldn't comply because the law was never intended for these types of products. and Health Canada is hammering them and shutting them down. So to see this bureaucracy that's all self-righteous, shutting them down and hurting people, they can't understand. They can't see it how somebody with a legal background could see it, because it's the law, right? And it used to grieve me. It still grieves me. So I can't say it used to grieve me. It still grieves me. So for that whole 31 years, I've just been watching Health Canada slowly and surely take natural health products away from us. We've already, like, innovation has ended. We're not going to have, we haven't seen any of those like blockbuster ones. That innovation has ended, and those companies couldn't, under our current regulatory environment, bring those products online today. So we've been frustrated before. I want to talk about the Charter of Health Freedom, but I want to share with you how it came about, because it's a fantastic story. And actually understanding how it came about and what the motivation for it is very powerful. So in 2008, the Harper government introduced Bill C-51, an act to amend the Food and Drug Act. And they were creating what's called the therapeutic product category and putting everyone in there. And that's where these $5 million a day fines came from, and these truly inappropriate Health Canada godlike powers that move us out of the rule of law. And it was the NHPPA's first fight. We had just formed in 08. Shortly before that, there were other health freedom groups back then. Some new groups formed, and some major companies got involved in the fight, and there was this coalition. And Bill C-51 was defeated. An election was called, and the Harper government didn't dare reintroduce it. They reintroduced the sister bill, the Consumer Product Safety Act, and unfortunately, that bill was passed, which it will not help consumer safety at all. But we sure moved away from the rule of law in almost all of our economy. If you read that bill or watch my testimony at the Senate on that bill, it's truly frightening. But they did not introduce Bill C-51 again, so we won. But we're all just exhausted. And so the NHPPA had 2 national conferences. We needed 2 to get to the solution. And so basically we invited people from across Canada, and it was the broad spectrum. We had consumers, we had practitioners, we had manufacturers, we had distributors, we had, just freedom group people that, were interested in this issue. And the question at the conferences was, look, Health Canada will come out with an initiative that's going to decimate us. It's going to restrict our access. We all organize, we all fight it, and we're happy and elated if we just didn't lose too much. But there's this long-term war of attrition, and like I say, Health Canada seems to plan in 100-year cycles. So, but we're slowly losing. How do we solve this? Because, we understand this is life and death. This is sickness and health. Like this, there's nothing more important than this fight. There's nothing more important to us than life and health. You're sick and you tell me that anything else is more important than being healthy. It's not. Money doesn't matter. Family doesn't matter. I mean, if you are suffering terribly, you don't even want to be alive. So how do we solve this was the question. So we tried to answer that question. And after, 2 conferences, 2 kicks at the can, the solution is really we need like a health bill of rights. We call it the Charter of Health Freedom, but it's a separate piece of legislation that has, like a bill of rights, it has primacy over all other legislation. And what it does, so the first thing the Charter of Health does is it creates basically a codification of serious health rights that courts tell us we have. So it doesn't create any new rights, but it legislates health rights that the courts say that we have that are tremendously important if we're going to have any sovereignty over our own bodies and any say on how we're going to treat ourselves. The second significant thing that the Charter of Health Freedom does is it creates some legal presumptions that don't exist, but are tremendously important for individuals if they want to actually have a say in how they're treated when they're sick. One of the most important ones is that it creates the legal presumption that you, the individual, are the best source of information as to whether or not a treatment works for you. I mean, that's common sense for those hearing it. I mean, you know if a treatment's working for you. But because there isn't that legal presumption, sometimes you are overridden. And sometimes there are things done in hospitals and in the health system because that presumption doesn't exist. The next thing that the Charter of Health Freedom does, which is tremendously important, is it takes the regulation of natural health products and other low-risk treatment modalities, and it moves them from Health Canada into a new ministry called the Ministry of Wellness. And then this ministry does not just have the obligation to regulate them in a protective way, such as protecting us from fraud and adulteration and products that actually are dangerous. But the Ministry of Wellness has a legal obligation to protect and promote our access to these low-risk treatment modalities. Well, think about that in the context of natural health products. Here we've been in this environment for about 35 years where Health Canada has done all that it can to restrict our access to natural health products, to stifle innovation, to make them so expensive that many Canadians can't afford them. Well, imagine if all of a sudden, instead of a bureaucracy whose actions, you don't look at words, their actions have been clearly trying to actually take them all from us and keep us fully in a chemical pharmaceutical model. Well, imagine what the world would be like if we had a Ministry of Wellness whose legal obligation was actually to protect and promote our access to natural health products. I'm just smiling because I love the Charter. Another thing that the Charter of Health Freedom does is it basically mandates a balanced risk analysis in the regulation of natural health products. Because Health Canada, in its very fraudulent approach, and I say fraudulent because Health Canada presents itself as there to protect health. But if you actually are asking the question, how do we get good health outcomes? If we are going to regulate natural health products at all, because you have to ask the question, if you're trying to get good health outcomes, should we regulate these? See, they're not regulated in the United States. They weren't regulated in Canada before. In fact, we didn't have any regulations of any measure until 2024. And even when those regulations came into force, because Health Canada couldn't comply with them, there wasn't a deadline where you had to comply until 2015. I mean, it's only just a brief period of time that they've been regulated at all. And we've had worse health outcomes, in my opinion, because we've had restricted access. So if you want good health outcomes, the first thing you need to ask for natural health products is, should they be regulated at all? Meaning, the question needs to be answered. Would we get better health outcomes if we didn't regulate them versus if we did regulate them? If we are going to regulate them, what is the method of regulating them to get the best health outcomes? And you don't just look at risk. You see, this is the game Health Canada plays. Is they'll come out with all these figures, in Standing Committee of Health or in Parliament are just absolutely outrageous. And when asked, well, can you give the data that you're basing that on? They refuse. But in any event, you have to ask the question, what is the danger of restricting access? And then increasing the costs to the point that low-income Canadians just have no hope of accessing. And we had Dana explain to you and show you that clip from Dr. Bonnie Kaplan. And Dr. Kaplan, thank you for sharing that wisdom with us. You've just been a champion on the truth of the importance of micronutrients for health. And you're somebody that we're proud to know, and you're a true Canadian champion. And I just thank you for sharing that with us. And it's so important. United States Department of Agriculture years ago did a report basically showing how the levels of nutrients in our soil have dropped because of our farming practices, and then linking chronic disease after chronic disease after chronic disease to chronic malnutrition because we're not getting the vitamins and minerals we need in our soil. So, this is life and death, and the idea that we have to fight over vitamins and minerals and plant-based remedies is just absolutely crazy. So back to the Charter of Health Freedom. Another thing that the Charter of Health Freedom does is it creates a health freedom ombudsman. Because in the area of health, if Health Canada or any other agency is putting you in the position where you're losing access to a treatment that you depend on for your life or you depend on to stay healthy, you have no voice. And and I'm a lawyer. I've spent my career in court. I've likely run at least 1,500 trials, and many of them months-long trials. And in my opinion, even if you have money, if your life is threatened because you've lost access to a treatment, you probably don't have time to get through the court system, money being no object. But most Canadians, money is an object. And they couldn't afford to go to court anyway and pay for the experts on a rush basis to get the affidavits done and the like. And so what do you do if your life is threatened in Canada because the government is restricting access to a treatment, be it a drug treatment or be it a natural treatment that you rely on for your health? You have no remedy. And so the Charter creates the office of a health freedom ombudsman to try and solve that problem. So it's absolutely an essential solution. I think it is the solution, and we need to push ahead with the Charter in a way that we never have before. And never before have I understood that we have to solve this, and we have to solve this quickly, because it seems that Parliament has become completely unresponsive. And we have to build a coalition this year in 2025 that is large enough to truly force Parliament to come to terms with us on this and just allow us sovereignty over our own bodies like we used to have not that long ago. I mean, this is just recent. This is just a recent thing, which is, again, how you know it's an absolute fraud. It's not like we were less healthy in 2003 than we are today, where we were completely unregulated. And before 2003, in fact, I would argue we have become much less healthy than we were. And certainly, again, in the United States, they're unregulated. They're having better health outcomes. So, yeah, so I think I'll stop there and take questions. But I invite everyone. The Charter of Health Freedom has its own website. So the NHPPA, we held those conferences. We were instrumental in drafting it, and we kind of shepherded it. So we've been the ones collecting the petitions. But the intention, its creation wasn't NHPPA. It came about from a coalition, and it's intended to belong to everyone. So we've always kept a separate website for it so that it's clear it's its own standalone. And we invite any group to partner with us in pushing this forward. We're going to have some exciting announcements coming forward. And this is going to be the year where we do some amazing things together. There's some things coming that the NHPPA is going to engage in that are truly exciting. And if you're not subscribing to our social media channels, do so. Now is the time to get the network of your family and friends that are like-minded to subscribe, and also to our newsletter, because we're going to start doing things and undertake a project that's going to need a lot of pushing out and a lot of support. And if you're not donating, please donate, because like I say, we're going to have some incredible needs coming up, but it's terribly exciting. So just wait and watch to see what's coming down the pipe. But please get people to subscribe. Let's start growing this network. And if you're not donating, please do. And those that are donating, like, thank you. We're a lean outfit. We're the mouse that roared. We're really proud. And, we're kind of stepping out on faith that this project that we're going to undertake is really going to help a lot of Canadians.
Okay, and with that, thank you everybody for joining us tonight.
Thank you, everyone. We encourage you, please, first to subscribe to our free weekly newsletter that will keep you posted on all of these details as they come up. As you've noted in chat from your questions, there's a lot on the table. There are a lot of great questions tonight about the future. So if you want to stay up to date with that, just simply head off to nhppa.org/subscribe. Links and QR codes have been present throughout the evening to just simply get a free exclusive newsletter from us that will keep you up to date on actions as they happen. And with that, we thank you very much for joining, and we'll see you next month for another NHPPA show.